Thank you, Mr. Speaker. Through you to the members. I rise today as the chair of the Joint Committee on Public Health in strong support of House 5595, an act prioritizing patient access to care. I want to thank the Speaker. I want to give a very special thank you to the gentleman from the North End. And I want to thank my two colleagues, the gentlewoman from Somerville and the gentlewoman from Northampton, who have fiercely and consistently championed and centered reproductive care and access to health care. Most importantly, I want to thank all of the women, birthing people, and families who've come before all of us, including my committee, to share heart-wrenching testimony. Thanks to their bravery, we can do what government is meant to do: make people's lives better by listening and acting. We've done this a number of times over the last couple of decades, and in 2022, when we made a bold commitment to protect abortion access in Massachusetts, we meant it. And today, we continue to move forward so that there are no legal ambiguities standing in the way of access to critical abortion care. I want to begin with a simple truth, because abortion care is health care. Reproductive care is health care. And at no point in pregnancy are lawyers more qualified to make a medical decision than the patient and her provider. Not at 12 weeks, not at 24 weeks, not at any point. The only reason abortion care is a legal issue is because of politics and ideology, because of the Supreme Court, and because of Congress. We have taken decisions that belong in the exam room and put them in the Supreme Court. Today, we are putting those decisions back where they belong. Women's bodies are not up for political interpretation. As chair of the Joint Committee on Public Health, I have had the incredible privilege of listening to patients and families who've been denied care and traumatized, and to doctors who've been unable to provide necessary care. Today, we remind our constituents we trust patients and their doctors. We know that the person most qualified to make a medical decision is the patient living through the pregnancy and the doctor caring for that patient, not a politician, not a lawyer interpreting an ambiguous statute, not an insurance provider, not a hospital attorney calculating legal risk. The patient and the provider. That's where these decisions have always belonged. I have heard stories that I will not forget, and I'd like to share at least one of those with you. Kate Deneen has shared her stories with many. Kate was carrying a deeply, deeply wanted pregnancy when she learned that her baby had suffered a catastrophic stroke in utero. She asked providers, "What are my options?" And they told her, you still may be able to explore termination if you're able to travel. And she asked, travel where? Because she should have never been asked that question. She was in a state that had access to some of the best medical care in the nation. And then she was told she had to leave. Kate was fortunate enough to have the resources to travel. She and her husband drove 500 miles to a clinic in Maryland. They had access to a car, they had childcare. They were able to take time away from home and work and had to pay $10,000 for the procedure out of pocket. They had the resources that many people do not. And even with those resources, the experience was physically and emotionally traumatizing. Kate was already coming to terms with that reality that the pregnancy she so badly wanted was not going to continue, and was grieving the loss of a very, very wanted child. She received compassionate and high-quality care in Massachusetts, and then she and her husband got back in the car, drove 500 miles back to Massachusetts, where she went through labor and delivery at the hospital she had to leave in Massachusetts. She described the experience of leaving her care team and community as heartbreaking, horrifying, harrowing, and deeply frightening. She said that although what they were doing was legal, they felt like fugitives, forced to flee their home state and then return to continue the process. We would never have accepted that for any other medical treatment. We would call it dangerous and cruel. which is why we passed legislation in 2022. But we continue to hear that not all hospitals, providers, and attorneys were aligned. And so today, we are here so that there's no confusion on what our intent was then. It continues to be our intent today. We are reaffirming that we meant it. There are birthing people who were forced to carry to term knowing that their babies would not survive, or knowing that their babies would survive only briefly with profound medical complications. And we cannot fully measure the trauma of what it means for a parent and for a family. No one should have to go through that. And certainly no one should be forced to endure because the people in government decided they, not the patient and the doctor, were more qualified to make a medical decision. One of the many responsibilities we have as electeds and the privileges is to listen and to honor people's stories. Our role is to make people's lives better, and at the very least, not to be complicit in causing harm. In no uncertain legal terms, today, we are providing the clarity that we meant in 2022. And we are centering medical decisions to be made according not to legal risk, but rather to medical judgment. We continue to affirm our commitment to women's health, to all of our health, our entire body. During committee hearings, we heard from a provider that when a New England patient arrived at her clinic in Maryland before 2022, she felt the immense pride that her clinic was able to serve them, but deep anger that they had to come so far to get the care they deserved. Patients arrive exhausted physically, emotionally, and financially. We continue here in Massachusetts to recognize that there is no point in pregnancy in which the government becomes more qualified than the patient and her doctor to a medical decision. This bill does not tell a patient what decision to make. It does not force anyone to have an abortion. It does not take decision-making away from the patients. It says that when a patient and their doctor are making a deeply personal and complex medical decision, the Commonwealth continues to trust them. Because medicine is complicated, pregnancy is complicated, and every patient is different. And no statute can anticipate every diagnosis, every complication, every pregnancy, or every patient. And as one provider testified, arbitrary gestational limits do not reflect the clinical reality. When ideology and misogyny shape our laws, as they are at the Supreme Court and at the national level, instead of medicine and evidence, those laws will always fail. And when they fail, it is women and birthing people who bear the consequences. Today, we stand firm that abortion care is health care, and we are placing that care exactly where we always intended it to be, back with the patients and doctors. Massachusetts has been a national leader in protecting reproductive freedom and ensuring access to health care. I'm so proud to stand with my colleagues who have continued to set the standard for what it means to protect reproductive care, expand access, and affirm that healthcare decisions belong to patients and their providers. In Massachusetts, our commitment continues to be clear. Women, birthing people, and members of the LGBTQ+ community deserve access to medically appropriate, evidence-based care without political interference. Ideology and politics have no place in the exam room, and it will never be acceptable reason to deny someone the care that they need. I respectfully ask my colleagues to join me in voting yes today on House 5595.
Chair